Welcome back. New data this morning from AARP looks to prove accusations big drug companies are guilty of price gouging. AARP's new report finds brand name drugs cost 18 times more than generics. Joining us right now in a First on Fox interview is AARP Health Services Research Director Leigh Purvis. And Leigh, it's good to have you on the program this morning. Thanks so much for joining us.
Thank you so much for having me.
Now, one of the reasons that some of the brand names are higher at certain times is because there isn't any competition out there, right? But then when the patent goes away and the generics come in, typically you see those prices go down. Tell us what you've seen.
So what we saw in our most recent report is something that we've seen for about the past 15 years, which is that generic drug prices decrease on average. What was particularly striking to us, though, was the difference between brand name drug prices and generic drug prices.
So it's that much higher, 18%, you said?
18 times higher, actually, yeah, which really drives home both the importance of lower-cost generic prescription drugs, but then also the importance of doing something about really high-priced brand name prescription drugs.
Now, do you think people understand that brand names are 18 times the price of the average generic, but the generic drug is the same thing?
That is something that we really try to drive home to our members and to all Americans, is that they are the exact same product. So you really want to make sure that a generic equivalent isn't available, because you could be missing out on some substantial savings.
Generics already account for 9 out of every 10 prescriptions filled in the U.S., but they're not represented that in terms of spending. Explain that.
Absolutely, and that really comes back to that price differential. They only account for about a quarter of spending, and that comes back to the fact that they are priced so much lower than these brand name prescription drugs.
Yeah, one of the issues, I mean, we've had on, a couple of CEOs in the sector who say it's really the structure of the industry. There are so many middlemen around that need to get a take in terms of that price of a brand name drug, and that's why the price is so high. Are you buying it?
That is definitely a narrative we're hearing a lot lately,
yeah.
But the reality is that prices are set by drug manufacturers. So the root of the problem is their pricing behavior.
And so what do you want to happen? How are you going to get this to resonate, not to raise prices and have such high prices for drugs that people need, life-saving drugs in some cases?
Absolutely. AARP actually just embarked on a new campaign called Stop RX Greed, and we are very focused on solutions that will help bring down prescription drug prices. And part of that also is making sure that there's adequate generic competition to help people as well.
Why? How do you do it? Is it just more competition, more generics on the market?
More generics on the market certainly helps, but the reality is manufacturers' pricing behavior is out of control. And as you mentioned, there's a lot of price gouging taking place. So some of the solutions need to address their pricing behavior as well.
And these are widely used by older Americans for the most part.
They are. All of the drugs that we focus on when we're tracking prescription drug prices are ones that are the most widely used by Americans age 50 plus.
So give us some examples then, Leigh. Give us some examples of some of those drugs that are very widely used. Maybe our audience knows those drugs and what the prices are relative to generics.
Sure. So if you take a look at, for example, a Lipitor, those products, or that product, can reach well into the hundreds of dollars. But if you look at the generic product, it's well under $100. So that does come back to the differential that really can result in some substantial savings for people.
$100 for what? What is the dosage that you're referring to? I mean, you're talking about tens of thousands of dollars on a yearly basis, right?
Absolutely. And you do have to be mindful that some of that is going to be affected by your out-of-pocket requirements. Some people have a flat copay, so they're not necessarily going to be paying the full price of the product. But the one thing we always want people to be mindful of is that full price of the product is being paid for by your health insurer, so you will see that cost come out in your premiums.
And so when you look at the generics out there, are there usually generics right alongside of the brand name drugs that people can take as opposed to the brand names? Because it really depends on where the patents are.
Absolutely. It's just worth a conversation with your healthcare provider. It's hard to say exactly how many drugs have generics available, but a majority of the widely used drugs that people are using for things like cardiovascular conditions do have generic equivalents, so it's worth a conversation with your doctor or your pharmacist.
What do you want the government to do? The Trump administration has been trying to create more competition to actually pressure prices lower, those brand names as well as generics. What else do you think government can do in this regard?
Yes, and we have really appreciated the administration's efforts so far. One thing that AARP has long supported is secretarial negotiation, or allowing Medicare to negotiate on behalf of its Medicare beneficiaries. We think that's something that really is long overdue and could really reduce prices for those people. And again, going back to generic competition, we're very supportive of efforts to help increase the speed of generic competition. So things like eliminating pay-for-delay agreements, where brand name drug companies and generic companies kind of work together to delay the availability of generics. And also the CREATES Act, which would help prevent brand name drug companies from blocking generic competition.
Does it feel to you that the FDA is moving faster along in terms of getting these generics through and back out to the market?
Absolutely.
Yeah?
FDA has been doing a great job. Yes, very much appreciate their work.
All right, Leigh, great to have you. Thanks so much.